Let's continue with arteries and veins and look here at pulse pressure. Think about what you're doing when you're feeling somebody's pulse, right? Everybody's seen this done many times before. What you're feeling is not the blood flow through that artery. What you're feeling is that radial artery expanding, in other words, stretching out, and then recoiling over and over again. So what you're really doing is detecting that change between the systolic and diastolic. Remember, systolic or systole is contraction of the ventricles, where the diastolic or diastole is relaxation. So think about if you have two fingers on that radial artery in somebody's wrist. Every time the ventricles contract, there's your systolic pressure. They shove blood into that artery. The pressure rises and the artery expands. Then with diastolic pressure, the lower the two, that occurs every time that ventricle relaxes to refill and the pressure drops a little. So with every systolic, pressure goes up, artery stretches. With every diastolic, pressure drops and the artery recoils, gets a little smaller. So you're feeling that expansion of that artery with every pulse. That's what you're actually detecting there. And anytime you see increases in stroke volume, remember, stroke volume is how much blood is being pumped with each one of those systolic or cardiac cycles there. That would definitely increase that pulse, make it easier to feel because there'd be more stretching of the artery. Also, if vascular compliance decreases right there. We talked about that in a previous video. Compliance tends to decrease with age. Everybody's heard about hardening of the arteries. Well, think about as you get older and the arteries harden, what would be wrong with that? Well, with smaller pipes, you're going to move less blood, and there's going to be more resistance to the flow. If you've got more resistance, you're going to have to generate more pressure to try and push the same amount of blood through a smaller pipe. Looking at pulse pressure, you can do this to determine somebody's heart rate, right? Often it's monitored for, say, maybe like 20 seconds. You multiply the number by 3. Of course, there are different ways that you could do it. Most frequent place, again, is that radial artery. That's one of those arteries that's relatively close to the surface. You could also use one of these carotid in the neck. Be a very good place to do it too. Let's look a little here at capillary exchange. That's that swapping of material across the wall of those capillaries. And remember, why is it that most exchange of materials in and out of the blood happens here? Because when you get to a capillary, there's nothing but a simple squamous wall, that endothelium. It's as thin as it gets in the human body. It's all that separates the blood on the inside from the tissue around it. So thin layers allow for the swapping of materials, thick ones don't. But when you look at how this material is moving in and out of the blood, a lot of it's just moving by simple diffusion. Remember, the cells love diffusion. They don't have to expend any energy, right? It's just materials moving from high to low concentration. And very small or lipid-soluble materials tend to move across this endothelium the best. Look at gases like oxygen and carbon dioxide. They're lipid-soluble, so they'll move through the lipid layer of those cells. Remember, cell membranes are about half lipid. They'll move through them quite easily. But again, the larger, more water-soluble, not going to move through them nearly as well. Blood pressure we've looked at before. This is one thing that changes capillary exchange. Think about if your blood pressure goes up and you got more pressure on the inside of a capillary. That tends to force more material out into the tissue. Just the opposite would apply too. What happens if the permeability of the capillary changes? Inflammatory chemicals will do this rapidly. Think about if you get damage to a tissue and these chemicals get released, you're going to see the blood vessel wall get more permeable. More material will move out of the blood into the tissue, and that's why it swells. Osmosis has a big effect too. Remember, water likes to move from an area of high to low concentration. You put more water into your blood, more of it's going to tend to move into the tissue to where there's less of it. Fluid also moves more out of a capillary on the artery end, and more tends to move back into the capillaries over on the vein end right there. Think about why on the artery side of a capillary, there's going to be higher pressure on the inside. More stuff's going to be coming out where it's lower. Back over on the vein side, the far end of the capillary, where pressure's dropped, more stuff's going to tend to come back in. It's always moving in both directions, but more comes out on the artery side of a capillary. More stuff comes back into the blood on the vein side. But looking also some more at capillary exchange, we have to look at a net filtration pressure. We have to look at the difference between the two pressures at work at a capillary. Now, the pressure on the inside of the capillary is what's called hydrostatic pressure. This is the pressure generated by the left ventricle of the heart in most places of the body. So when you've got this pressure on the inside, it tends to force material out of the blood into the tissue. But in the tissue, there's always a certain amount of water and osmotic force and pressure. And that's always pushing back against that hydrostatic. So wherever the pressure is highest, it's always going to move towards the lower. So again, on the artery side of a capillary, pressure is higher on the inside. That means the hydrostatic's higher. The osmotic around it's lower. More stuff comes out of the blood into the tissue. Over on the vein side, you see just exactly the opposite. The pressure inside the capillary is dropped. So it's higher in the tissue, lower in the capillary. More stuff tends to come into the capillary over on the other end. So we've mentioned that before. Now again, think about if a capillary becomes more permeable. Again, inflammatory chemicals are very good at doing that. It'll let material leave the blood and go into the tissue, and where those solutes go, the water's going to follow. See a lot of swelling, edema, fluid buildup in the tissue at that time. But also if for some reason you lose any of the solutes in the blood, it's countless numbers of proteins floating around in the blood. If you don't have enough of these proteins for whatever reason, few of them listed here, fewer solutes in the blood, not going to hold the water as well. Water will leave the blood, go into the tissues, and cause swelling at that time. Blockage of veins. If you block the outflow of a capillary, the blood can't get out. More material will be forced out into the tissue. Also, if you have blockage or removal of a lymphatic vessel, where the arteries bring everything into a tissue, the veins take 90% of it out, and the lymphatic vessels get that remaining 10% out of a tissue. So if you lose one of these vessels or it gets clogged up, you're losing part of the outflow, and that would definitely cause a buildup of fluid material in the tissues of the body. So again, there's some pictures you can look at, and again, links to the study guide.